Welcome back, guys, to Part 8 of our CPC exam series. Today, we're building the ultimate blueprint of the cardiovascular system. You know, the heart is totally notorious for tripping up coders, but by the end of this explainer, you are going to master surgical and diagnostic code selection. I'm your host, and before we dive in, make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, here's our agenda for today's explainer. We're going to cover 1. Anatomy and coding, 2. The heart map, 3. Valves and flow control, 4. Vessels and circulations, 5. Pathologies and procedures, and finally, 6. A cardiovascular cheat sheet.
Okay, Section 1, Anatomy and Coding. We're starting our journey right here to establish exactly why knowing this anatomy is literally the ultimate key to your coding accuracy.
The crucial point to remember is you really can't just memorize cardiovascular codes. So many procedures and diagnostics depend entirely on exact anatomical structures. Think about it. If a surgical note mentions the tricuspid valve, but you accidentally code for the mitral, well, you've just failed that claim. You absolutely have to understand the specific chambers, valves, and vascular territories involved to get it right.
Moving on to Section 2, the heart map. Let's look at our foundational blueprint and map out these chambers.
It's kind of amazing, but the human heart operates as this brilliant dual pump system. The right side is entirely dedicated to receiving deoxygenated blood and shipping it straight to the lungs. Meanwhile, the left side, that's the absolute powerhouse. It's incredibly muscular because it takes in that freshly oxygenated blood and has to forcefully pump it out to the entire systemic body.
Now, as a coder, you need to visualize how the heart is actually layered. We start from the inside with the endocardium, move through the thick myocardium muscle layer, out to the epicardium, and finally the pericardium, which is that surrounding protective sac. Knowing this exact tissue depth is huge. For example, if you're coding a pericardiocentesis, where a needle is inserted to drain fluid, you're specifically coding for the penetration into that outer pericardial sac. All right, Section 3, valves and flow control. We've got the chambers mapped out, so let's look at the anatomical doors controlling the flow between them. By spatially anchoring the mitral and aortic valves strictly to the left heart and the tricuspid and pulmonary valves to the right, you honestly gain a coding superpower. You'll instantly know which side of the heart is being operated on when you spot these specific terms buried deep in a complex, multi-page surgical note.
Section 4, vessels and circulations. The heart is pumping, but that blood needs a highway system, bringing us to our vessels and circulations.
Here's a definitive, simple rule you just have to commit to memory for the exam. Arteries always carry blood away from the heart while veins return it. This distinction is heavily tested in vascular coding. Just keep in mind that the pulmonary artery and veins are the tricky little exceptions when we're talking about standard oxygenation levels.
These major pathways basically define systemic versus pulmonary issues in the body. But listen, I really want you to pay special attention to the coronary circulation. These are the specific arteries supplying the heart muscle itself. Diseases here lead to major events like heart attacks, and coding the subsequent interventions, those are some of the most complex scenarios we face on the exam.
That leads us perfectly into Section 5, pathologies and procedures. Let's tie these anatomical concepts directly to the high-yield scenarios you're actually going to see on the test.
When you encounter diagnoses like coronary artery disease, heart failure, or arrhythmias, your anatomical knowledge has to kick in to verify the documentation. Take heart failure, for instance. Its specificity relies heavily on identifying whether the issue is systolic, diastolic, or a combination. You literally can't code to the highest specificity without knowing exactly what part of the pump is failing.
Then there's CAP, or coronary artery bypass grafting. This is a massive topic on the CPC exam. Accurately coding this means you have to play detective and identify exactly which blocked coronary arteries the surgeon is bypassing. But here is the million-dollar coding question. If the surgeon is creating a bypass, where are they getting the new pipes from? And why does the exam care so much about this one specific detail? Well, the answer is that CPT codes are distinctly separated based on the source of the vessel. Did the surgeon use an arterial graft, like the left internal mammary artery harvested from the chest, or did they use a venous graft, like the saphenous vein from the leg? Mixing these two up is a guaranteed way to lose points, making your understanding of vessel anatomy absolutely critical. Now, looking at diagnostic procedures, an echocardiogram is an ultrasound entirely focused on visually capturing the chambers and valves we just mapped out. Providers use this constantly to assess anatomical issues, like, say, a stiff stenotic valve or regurgitation where the blood is actually flowing backward.
When coding an ECG, you have to pay really close attention to the billing components and modifiers. You gotta ask the documentation. Did the provider perform the whole test globally for code 93000, or was it split, where maybe a facility just did the tracing for 93005, and a separate interpreting physician simply wrote the report for 93010? Always watch out for those professional and technical components.
Finally, if those arrhythmias require surgical intervention, coding for pacemakers and ICDs is determined entirely by where the hardware goes. You have to identify single versus dual chamber in the operative note, meaning are the leads placed in just the atrium, just the ventricle, or both? Okay, Section 6, Cardiovascular Cheat Sheet. To wrap up our journey today, let's condense this massive anatomical system into a quick review. Take a mental snapshot of this cheat sheet right here. Or, you know what, just pause the explainer and screenshot it. Remembering these foundational rules of left versus right and arteries versus veins will honestly help you effortlessly navigate almost any cardiovascular operative report you see on the exam.
So, since the right side of the heart pumps directly to the lungs, we're going to follow that exact anatomical path in part 9 of this series, where we decode the respiratory system. But I want to leave you with this question to ponder. If a patient has severe left-sided heart failure, where do you think all that backed-up fluid is going to eventually end up? Think about the lungs, and I will see you in the next explainer.